Hi, I'm so glad you're here. Me and Blue, we were watching Magenta. She just came back from Africa. It's been about 3 to 6 days. But she's not really feeling well. What's that? What's that, Blue? Oh, you want to go get Magenta? Okay. Oh, there she is. Oh, what's wrong, Magenta? Looks like she has fever. And a headache? Oh, muscle aches. And she hasn't really eaten. She has a loss of appetite. Oh no. We better hurry and find out what this is because it could result in complications like dehydration, low blood pressure, shock, jaundice, and GI hemorrhaging. Do you guys want to come help me and Blue find out what's wrong with Magenta?
Yeah!
Okay, let's go! Now, I can't find Blue anywhere.
A clue! A clue!
There it is! We found a clue! It's a monkey. Well, a monkey is a reservoir usually for many different diseases and... This could lead to the jungle cycle, which is a mode of transmission, usually parenteral, where an infected monkey is bitten by a mosquito, and then that mosquito bites another person, and that's how the virus is transferred. This is a clue, so I better pull out my handy-dandy notebook.
Put in 2 ears, eyes, mouth, a cute nose. Oh, can't forget. I drew a banana
Because it's a monkey, and monkeys like bananas. Oh, I wonder where Blue went. There he is.
A clue! A clue! A clue!
A clue? Where's the clue?
On the over there!
A clue! Mim's Medical Microbiology. This looks like something we should write in our handy-dandy notebook. There's the book cover. And there are the pages. Ta-da! It looks like Blue went into the book. Oh. If Blue can do, we can too. There's Blue. And the magical Mims doctor.
Hi, Steve.
Hey.
Blue's been telling me about Magenta's symptoms. It sounds like she might have yellow fever.
How does one get yellow fever?
Well, you get yellow fever from an infected mosquito, usually Aedes aegypti species. It enters via the parenteral route, where it is a break in the skin, so the mosquito bites you. Then it attaches to leukocytes, platelets, and endothelium tissue inside the body.
Doesn't your body have an immune system to get rid of the yellow fever?
It does. Like all viruses, it's an intracellular pathogen, so basically hides from your body. Circulating antibodies in your blood and cells of the immune system can't fight against it because it infects and destroys leukocytes. This causes immunosuppression.
What exactly does yellow fever do to our bodies?
It causes 2 types of damage, direct and indirect. The direct damage, there's cell lysis, where there's like 4 main problems it causes. If you damage liver cells, you get a jaundice, which is a yellowing of the skin and a yellowing of the whites of the eyes. This is where the name yellow fever comes from. So why Magenta is looking kind of yellow these days instead of so pink. The platelets, if those are damaged, it causes like hemorrhaging, so lots of excessive bleeding. If the endothelium tissue is damaged, you get lots of fluid loss, super dehydration, and that can cause you to go into shock. If it crosses the blood-brain barrier, then you risk inflammation of the brain, getting encephalitis-like symptoms. The indirect damage, you get a release of cytokines. Those cause fever and flu-like symptoms. The most common way it exits our body, where it goes to infect another human. So a mosquito would have to bite an infected human, which then bites a healthy human. The virus is transferred, and another human becomes infected. This is an unusual cycle and only happens in urban populated areas.
Wow. Thank you, magical Mims doctor. That was awesome.
No problem. Here's Blue. You better go get Magenta some help.
Thank you. Let's go back home. Okay. That was a lot of fun. Oh, look. Magenta's over there with Dr. Salt and Dr. Pepper. And little Diet Dr. Pepper. Let's go check.
Well, what we could do is diagnose you based on your clinical symptoms, but that could be confused with other diseases such as malaria or viral hepatitis, which show very similar symptoms.
So what we should do is take either a blood serum or cerebral spinal fluid sample to look for antibodies and virus-specific IgM in the blood. We will use an ELISA test.
Unfortunately, there's no way to stop the replication of the virus. If your symptoms don't improve over the next 3 to 4 days, then you may enter the toxic phase.
If you do enter the toxic phase, we will focus more on supportive care, such as rehydration, antibiotics to prevent secondary infections, and hospital care. In the hospital, we would control bleeding and watch for kidney failure and possibly perform dialysis.
Hopefully, it won't get to that point though.
Now, why don't you go tell Blue the good news?
Oh, hey Magenta.
Mail time!
Mail time? Oh, here's the mail, it never fails and makes me want to wag my tail. When it comes, I want to yell, mail! Oh. Look, a letter. It has a vaccine in it. People that are 9 months and older should get this vaccine. It's good for 10 years. It's good for... Oh, well, look at this. It's a map.
A clue!
Oh, and this is just telling us that it's good for endemic areas like Africa and South America. Use it in a single dose, and it's called Stamaril, which is the live virus of the 17D strand. And you can find this at any local Travel Medicine Alliance facility. Different things that the community can do can include public spraying, destroying breeding sites of mosquitoes, and eliminating standing water, like Pail over there, or old rubber tires. Personal things you can use is insecticides with DEET, mosquito netting, and fully cover your body with clothing. That's all the time we have today, kids. Hope to see you next time.